as well as the incisions at the sites where vessels are harvested. In the past, bypass surgery routinely required that the client's heart be stopped and a cardiopulmonary bypass system used to oxygenate and circulate blood during the procedure. Some newer approaches can be used without stopping the heartbeat, so cardiopulmonary bypass is not needed. One such procedure is the off-pump coronary artery bypass, or OPCAB, for which special techniques are used to attach the distal end of the internal mammary artery to the occluded vessel. Thoracotomy and sternotomy are required for OPCAB. Another procedure called minimally invasive direct coronary artery bypass grafting, or mid-CABG, can be used for the client who has left anterior descending artery disease. Mid-CABG requires several small incisions between the ribs. A thoracoscope is used to access the left internal mammary artery and attach the distal end to the diseased artery. The nature of the CABG surgery and the fact that clients already have cardiovascular disease puts them at risk for a variety of complications. The cardiovascular complications of CABG are graft closure, myocardial infarction, pericarditis, dysrhythmias, and cardiac tamponade. You can prevent a graft closure by maintaining adequate blood pressure. To monitor for myocardial infarction, you'll ask the client about chest pain and watch for ECG changes that indicate ischemia. Pericarditis will also cause chest pain and a friction rub, so you'll listen to the heart sounds for a grating noise with each heartbeat. Monitor the cardiac rhythm, watching carefully for dysrhythmias, and check potassium levels. For cardiac tamponade, you'll listen for distant heart tones and check for a narrowing pulse pressure. As blood builds up around the heart tones will become less distinct. And what is pulse pressure? The difference between systolic and diastolic pressures, usually around 40. You'll monitor for a trend indicating that the pulse pressure is decreasing, so get into the habit of subtracting the diastolic pressure from the systolic. For example, with a normal pressure of 120 over 80, the pulse pressure is 120 minus 80, which equals 40. Now it's your turn. What is the pulse pressure for a client who has a blood pressure of 92 over 66? It's 26. Neurosensory complications include delirium, sensory disturbances, and problems with memory, attention, and concentration. There's also the risk of microemboli to the brain. There are also potential hematologic complications, such as bleeding or blood dyscrasias caused by the cardiopulmonary bypass machine. And there are respiratory complications, such as respiratory distress, pulmonary edema, hemothorax, and pneumothorax. Additionally, there is the potential for renal failure and infection affecting the wound, mediastinitis, or respiratory infection. Cardiac recovery, usually in the CCU, can be quite involved. Let's cover the nursing diagnoses that might apply after a CABG. First, there's pain. Good pain management not only makes the client more comfortable, but it also reduces the anxiety and enables the client to cooperate better with pulmonary and leg exercises. Remember, a good assessment will help you provide the best interventions. Incisional pain is treated initially with intravenous morphine. Back pain, however, may subside with repositioning and massage. Keep in mind that when giving morphine, you must watch for respiratory depression. In addition to analgesics, what are some other comfort measures you might use? How about relaxation techniques, such as imagery and distraction? Another nursing diagnosis is decreased cardiac output. What are the appropriate drugs to use? There are volume expanders such as albumin and hetastarch, and vasoactive drugs to maintain blood pressure. Dysrhythmias must be identified and treated promptly, typically with drug therapy. Risk for infection is a nursing diagnosis that applies here. What factors put the client at risk for infection? The surgical incisions, infusion lines, Foley catheter, shallow breathing due to pain, and immobility. So how can a nurse help reduce the risk for infection? By using aseptic technique for wound care, infusion site care, chest tube site care, and Foley care. and by administering prescribed antibiotics and pain medication. Other suggestions include using occlusive dressings, cleaning carefully around the Foley, and rotating the client gently in a bed that moves from side to side. Be sure your client and your client's family know the signs and symptoms of infection to report to the surgeon. Our fourth nursing diagnosis is ineffective breathing patterns. At first, the client will be on a ventilator and have a chest tube. Once the client is extubated, supplemental oxygen is administered by nasal cannula or mask. You'll support and encourage the client in breathing exercises, provide a pillow to splint the incision, and assist with ambulation as soon as it is permitted. Our next diagnosis is really a matter of putting yourself in your client's shoes. How do you think you would react to the news that you need heart surgery? Heart surgery often evokes anxiety and fear, and so you must be prepared to answer and address the client's questions and concerns. Give information in terms the client and the family can understand. Prepare them thoroughly for the post-operative experience. Cardiac surgery clients are commonly cooled to reduce their metabolic demands, so ineffective thermoregulation is another diagnosis that applies. Body temperature may be low when these clients come to post-anesthesia recovery. If too chilled, clients will shiver, which increases their metabolic requirements. Measures used to rewarm the client include warmed blankets, heating blankets, and warming lights. Be sure to monitor your client's blood pressure while he's being rewarmed, as vasodilation could result in hypotension. Altered thought processes are the final diagnosis we'll discuss here. Pain, drugs, and anxiety itself can make the client confused and disoriented in the recovery period. To reduce the risk of altered thought processes, orient the client frequently. Ask questions about place, time, and situation, and about the client himself. You should also try to provide periods of rest and treat pain promptly. Avoid restraints if at all possible. There is some evidence of lingering memory problems after cardiac surgery, especially if cardiopulmonary bypass is used. This is one reason that surgeons will avoid cardiopulmonary bypass if at all possible. So far, we've been focusing a bit heavily on the physiologic side, so now let's take an in-depth look at the nursing role for a client who has undergone cardiac surgery. In the preoperative period, and generally after a cardiac catheterization, you'll monitor the client's physical status and address his concerns and fears about bypass surgery. Family members and significant others will also need support and information. So, what will you include in your preoperative teaching plan? You'll cover preoperative routines. You'll tell them what to expect in the critical care unit postoperatively. For example, the IVs, ventilator, monitor, and chest tubes. It can be a little overwhelming for your client's loved ones in particular. Carefully cover postoperative routines to decrease complications: turning, coughing, breathing deeply, spirometry, leg exercises, and ambulation. Since your client will be intubated, help him select a means of communication to use. This is also a good time to teach about types of self-care and rehabilitation he'll need. Teach the client and family that post-pump depression is common and that it will pass. Your preoperative preparation can make the postoperative adjustment easier. Now let's take a look at postoperative nursing assessment. We'll begin with circulation. What would you assess? You'll start with vital signs and ECG pattern, then hemodynamic pressures, peripheral pulses in the operative leg, and skin color. Next, you'll assess oxygenation by listening to breath sounds and checking arterial blood gases. You can assess your client's comfort by evaluating pain location, the severity and type, then aggravating and relieving factors. You'll assess renal function through urine output and then move on to mental status. What components of mental status should you assess? Your client's level of consciousness, his response to commands, his orientation, and his emotional state. Finally, there's infection. How would you recognize infection in a post-CABG client? The same way you would in other postoperative clients, through temperature, increasing redness of the incision, separation